Welcome back. Some stories we are watching this morning. Day one of Ontario's new stay-at-home order. Still a bit of confusion when it comes to enforcement. The province saying the fine for failing to wear a mask or social distancing, $750. Organizers of parties or gatherings could face penalties of up to $10,000, and corporations could see fines of up to $10 million. And we've been hearing from health experts that one of the problem areas for COVID transmission has been in the workplace. Monty McNaughton, Minister of Labour, will be holding an 11 a.m. virtual announcement to talk about stepping up those workplace inspections. And to talk about the COVID situation as well as the stay-at-home order, especially here in Toronto, Mayor John Tory will be joining us just after 7 o'clock. So make sure you stay tuned to that. Now, as this order goes into effect, a lot of critics saying more support is needed to help people get through the dark months ahead.
There is no confusion here. It's very simple. Stay home.
We're saying to Doug Ford, do the right thing by these vulnerable people.
Two very different messages from Premier Ford and NDP opposition leader Andrea Horwath. But what more could the province be doing to keep people afloat? To discuss that and more, I'm joined by Charmaine Williams, Vice Dean at U of T's School of Graduate Studies and a professor at the Factor Inwintosh Faculty of Social Work. Charmaine, good morning.
Good morning.
I want to get your take first on what you think is missing from that announcement and the stay-at-home order, especially for communities that are really struggling right now.
Yeah, I think the thing about the stay-at-home order is that it's really directed at a segment of the population that can make choices to stay at home. And there are a lot of people who can't make those choices because they are in occupations that have been designated as essential, or just, for all kinds of reasons can't do that. I think we also have to consider that some of the things that make it possible for us to stay at home are other people working in occupations and unable to stay at home. And part of what we've seen is that there's a concentration of people from the racial minority communities in those kinds of occupations.
So indeed, we're talking about strains when it comes to financially, mentally. Mental health is a big one here as well. So let's first talk about financial. There's been that push for paid sick leave, but paid sick days, I should say. But as you mentioned, sometimes people are forced to make that choice, and that really feels like an unfair one.
Yeah, it's true. And not everybody has the same set of options, right? So sick leave is one that's very clear, because if you're in a job that doesn't have it, you can't stay at home and just choose not to pay your rent and put food on the table. But also you may be in a workplace where people aren't putting in the proper protections, and everybody has control over that either. So it's the idea that we're able to make choices isn't true for everybody. Not everybody has the same choices.
A new Leger poll suggesting women's mental health is more impacted than men's during this time. You talked about various marginalized communities, and part of that Leger poll also talked about women, single parents as well, marginalized communities, racialized communities really being targeted here. Does any of that surprise you?
Not at all, because I know that people kind of talk now like we have this situation and now these groups are falling through the cracks, but the gaps were always there. We're talking about populations, women, people of color, women of color, who have always been in situations that put them at higher risk for various types of health conditions and diseases. So you put on top of that now COVID is just the latest version of that. And because we're also talking about groups that often are at higher risk for all kinds of chronic conditions, it means that if they get sick, they also have worse outcomes. Mm-hmm. So it's really just revealing a problem that was already there.
So Charmaine, where do we go from here? What sorts of resources are available for these communities, and what can we do to help?
Well, I think that part of what needs to happen is that while we're in a crisis, of course, we're seeing it as a crisis, but really these are long-term problems and we need long-term solutions. So you already mentioned sick days and sick leave, that kind of benefit. And certainly there's been a lot of talk about things like a basic income being available, because the other thing we've seen is people have lost their jobs. So that's a lot of the financial stress that people are experiencing. And I think that also what we've learned is we have to be we have to find ways to make supports more accessible to people, because with the lockdown, a lot of supports that were available for people in marginalized communities aren't able to operate in the same way. I think there's been a lot of really good work by community organizations to find ways to still operate and reach the people who need them, but they obviously need more resources, and we need to think about how do we reach people that can't get to us in the same way.
Indeed, we need the outreach, but also the financial supports. Charmaine Williams, appreciate your time. Thank you.
All right.